no problem that we have here in Massachusetts is more important than providing medical care for our senior citizens. I believe that it is essential that we provide a medical care program which is financed under Social Security.
Welcome back, everyone. I'm Tamron Hall, live in New York.
And I'm David Schuster, live in Washington. Supporters of health care reform lost one of their most passionate, long-time and vocal advocates today.
David, when Senator Ted Kennedy endorsed Barack Obama for president, he was promised that health care reform would be at the top of the president's agenda. Senator Kennedy spoke about his passion for health care reform at the Democratic convention a year ago yesterday.
For me, this is a season of hope. New hope for a justice and fair prosperity for the many and not just for the few. New hope. And this is the cause of my life. New hope that we will break the old gridlock and guarantee that every American, north, south, east, west, young, old, will have decent, quality health care as a fundamental right and not a privilege.
Senator Kennedy was not as involved in the health care negotiations as he would have liked, certainly, as he was sorely missed by his Senate colleagues on both sides of the aisle.
No person in that institution is indispensable. But Ted Kennedy comes as close to being indispensable as any individual I've ever known in the Senate. It's huge that he's absent, not only because of my personal affection for him, but because I think that health care reform might be in a very different place today.
And joining us now on the phone, Dr. Howard Dean, former chairman of the Democratic Party and governor of Vermont. He's also, of course, the author of Howard Dean's Prescription for Real Health Care Reform. Thank you, Governor, for joining us.
Thank you very much for having me on.
We just heard the words of Senator Kennedy saying that he'd hoped that the old gridlock would be removed and that health care would be provided for everyone. But we are seeing just that, the same gridlock that he saw since the late 60s as he started the fight for health care reform.
Well, I actually don't think we are seeing gridlock. What we're seeing is a tremendous fight going on. But so far this bill has been through 4 out of the 5 committees it needs to go through. I think it's pretty evident at this point that the Democrats are going to deliver health care one way or the other. And if the Republicans don't wish to be helpful, then we can do it by ourselves. We have the votes to do it. We had a huge mandate in the last election, very big majorities in both houses. The Democratic president who kept his word to Senator Kennedy and did put this at the top of his agenda.
But when
I think this is a pretty big day. It's a sad day for America,
Absolutely.
But it's in some ways kind of day that Ted Kennedy would want us to have, a day of resolve.
And certainly my apologies, Governor, for not giving you an opportunity to share with our audience how you certainly feel about the passing. I jumped right into the health care, but I know that for all of you and for the Americans watching, this is not just about that debate.
No, it's not. He's such an enormous figure and such an extraordinary person. I wrote something about it this morning. He sat next to my mother at a wedding by pure accident. My mother was a Republican until 2004. And afterwards, he wrote her a handwritten note. And she, of course, was totally captivated and became a big Ted Kennedy fan. And I think he had that effect on lots of Americans over the years.
Governor Dean, as we've been talking about Senator Kennedy, so many people have been talking about how he was essentially, in the end, pragmatic. He would negotiate. But isn't it true that Senator Kennedy's committee was 100% behind the public option as far as the Democrats? And I wonder if Senator Kennedy, what he would think, or what do you think he would believe about the idea of negotiating the public option away for the sake of compromise?
Well, I don't think that's going to happen. First of all, I don't think anybody's going to do that. There's some talk about it, and I think it's pretty clear that's not where it's going to end up. The vast majority of Democrats in the Democratic caucus want a public option. The vast majority of Democrats in the House want a public option, and there's going to be a public option in the bill. I do think, and I will say, nobody is indispensable in the United States Senate, but Chris Dodd has done a terrific job. I know he was talking to Senator Kennedy on a very regular basis as this went through, and his bill certainly has Ted Kennedy's fingerprints all over it. But, you know, this committee did a great job, and they produced a terrific bill, and it's the bill that I think the Senate is, for the most part, going to pass in the fall.
Governor, what about those who say that President Obama will have to do what similar to LBJ did, going to Congress and saying we've got to do this for Senator Kennedy as it was done for the civil rights movement for his brother? Will we hear that kind of conversation, as those are stirring words to hear this man say it's the cause of my life?
You know, I actually think that President Obama would be very willing to do that, but I don't think he has to. I mean, Ted Kennedy had a 46-year career in the United States Senate. They all know him personally, and many of them have known him for decades. And so you almost don't have to say that at this point. I think everybody gets the idea. This is the time to do it. You know, we've lost a huge star and a huge pillar of strength, but in some ways, you know, after life is over, the pillar of strength becomes even stronger. And then one of the things I wrote this morning was that he will be at that signing ceremony.
Governor, thank you so much. We greatly appreciate your thoughts on the passing of Senator Kennedy, as well as his influence in this health care debate, even after he's gone. Thank you, sir.